It's Resource for Care time, and that's resource, the number 4, care.com. And Resource for Care interviews healthcare and wellness professionals in the Memphis area to connect them with seniors, their caregivers, and their adult children. Today in our studio, we have the owners, the co-owners of Mid-South Home Helpers. Did I get that right?
Yes.
Okay. And we're going to be talking about how to choose an in-home care provider. And as we get into that, we talked earlier before we got on air that we wanted to distinguish for you all the difference between what home health is and other what we call like non-medical type of help or custodial help in the home. So let's start off with, what does a custodial or non-medical provider do? What types of things do you help people with?
Good question. So basically, in a nutshell, the purpose is to assist families for any caregiving responsibilities, whether it regards to like housekeeping, helping dressing, personal care, toileting, bathing, those types of things. So that's really what we provide as in-home care agency.
Okay, and if somebody needed like meals made or transportation,
those are some services that we actually have added on as value for our client. Not every agency does that, so that's going to be one of the questions that you want to ask, is to find out exactly what services they do provide. Is it all within the home, or will they help get someone
are
out
they
of
willing?
the house?
Yeah.
Is that part of that? Can that be part of the care plan?
Sure. And do you just go into like residential homes, or is this the type of care that, like, if somebody needed extra help in a independent living or somewhere else?
Yeah, we actually can go into any place that an individual may call home. So again, if they live in assisted living or independent living, or even in memory care, we've offered assistance to family members that may need some additional care, or they feel like their loved ones are being, just need that additional oversight that the skilled nurses cannot provide.
Right. Well, we know that a lot of places that people are staying that are not their own home are, they have challenges with staffing. Yeah. And so to get individual care is tough from a facility that's struggling, themselves at times. We're not here to bash communities, but keeping good staff and maintaining is sometimes a challenge. That's what I've experienced. Is this something that if they needed someone to be in the hospital at bedside that they'd be able to do? Is that something as well?
Absolutely. We've actually had a recent client to where he was on dialysis. And his kidney function had started to diminish, and so the wife needed some assistance. She needed to be able to get away and gain some rest herself.
Right.
Otherwise, she was going to be in the hospital bed next to him. So we definitely can assist coming into a hospital and providing additional care from that perspective. And again, it's just whatever the family would want to keep. I mean, because we couldn't provide any kind of skilled care, right?
Sure.
We're just there to assist them and making sure that the client's safe.
Well, and how many families, I've been in that experience where you're at the hospital, you feel like you've been there all day, and then the doctor shows up 5 minutes after you leave, right? Yeah. And you do need to take a break. You have to eat, go to the lavatory, whatever. Maybe you have other family members that you're caring for or living with. So that would be a good resource in that regard as well. That would be invaluable.
We try to be an extension of the family. We're not the actual biological family, but the client becomes part of our family, and we become part of theirs because we're so involved in their day-to-day, and they come to rely on us, and we are able to provide that extra layer of care that a family wants someone to come in and do that they would do themselves if they could be there. And we know that not everybody can be there all the time.
Yes. Well, let's dig into our topic then. So what do you suggest people should consider when they're looking to get this type of help that we talked about?
Yeah. I think to start, I mean, know what your needs are for the client, and the individual themselves. I mean, do you need the respite? Is it that you need?
When you say respite, what do you mean by that?
So you rest yourself.
Oh, I
You
see.
get that,
Okay.
Yeah, you get the time to go and take care of yourself, having the self care.
Yes.
So, because any caregiver, as we can both attest to, we've been caregivers for loved ones.
Yeah.
So, but you need that time away to self care. So we offer that. But know what the needs are of the client and
Right.
of the family.
Okay.
And then the next step would be just understand where that fits into your schedule. Like, what time of day. Again, the client we just had recently for the hospital, she wanted to be there during the day so that she can make sure she was there for the doctor's
Yes.
visits and those types of things. But then allowing her to go home and get rest at night.
Right.
So it's
And
all
I mean,
different.
and to give her some peace of mind, I would think,
Correct.
right?
Yes.
Yeah.
Yeah. Yeah, knowing that he's cared for. So that's the first initial probably start. And then I think if the next thing, and this is where Genell's expertise comes into play, is how to pay for it. Because that's always
Yeah.
key. So
Yeah.
And part of that, it might be paid by long-term care insurance if you've been able to plan ahead of time and make those arrangements. It also depends on how your policy is written as to how soon long-term care will pay and if it will pay for in-home care. Some of the older policies don't have in-home care written into it because it wasn't around back then. Not in the way that we know it now, but many of your newer policies will include that rider for families to be able to help with care. Because we all know we're all busy and we have different things going on in our lives, whether it's working or caring for others. A lot of times we find that children are caught between taking care of their own children and taking care of their parents.
Right.
And so they're still working, they're still have a family at home to care for too. And those are the kind of people that we're happy to help.
Right.
Along with those who live far away and need help with their parents locally.
So if I were, doing my homework for a family member, what are the questions that I need to be asking, a home care company like yours or any others?
Yep.
What questions should I be asking?
I think the first thing that you need to think about, number one, is because kind of in regards to finances, what is it going to cost me? Look at your budget, make those understandings from that perspective. Because another thing you don't want to do, and this is something that is advice to you guys, do not hire somebody off the street. If you do hire somebody, make sure that they're certified, make sure that they're licensed, because if you have some kind of safety issue or the client or your loved one gets injured,
Right.
There's potentially liability if the caregiver that you've hired becomes injured.
Yeah.
Then you become liable.
Yeah, we have a friend who does, like home insurance. And every once in a while she'll remind us that, don't hire contractors that are not licensed, because if they get injured in your home, then you're liable for that. And if they need rehab or they need to go to the hospital, you could be paying out of your pocket. And what you thought was going to be really inexpensive turns out to not be. And I would think that would be similar in this case.
Yeah, absolutely.
Yeah.
Absolutely.
So it's hard to think of finances. I mean, I'm going to take a step back because I think while we're educating now, I think a lot of people don't know what non-medical or custodial care is. So what things should they be, asking about what you do or how you do it, or, I mean...
And that's a great question, because so many people do get home health and in-home care confused.
That's a good point.
Home health is when a doctor, a physician, a provider orders a service that can be done in your home that your insurance will pay for, whether it's Medicare or your regular group health insurance or individual health insurance. All of that are medically provided.
And Medicaid too, right?
Yeah,
Yeah.
Medicaid for those who
So
have.
anywhere that covers your insurance,
But
whatever.
you still have to have a doctor's order for
Okay.
that. That's what's different. In-home care, you don't have to have a doctor's order. You just have to have a diagnosis if you're trying to get file on your long-term care that's supported in your policy. But if it's private pay, you don't need anybody to tell you that you need that except for yourself.
Right. So the first would be to distinguish whether you need home non-medical or you need home health. And then what else should they be asking, a company like yours?
So I think you need to, for non-medical, you need to understand what services are provided.
Okay.
Like, what are we actually doing when we can come in the home?
Right.
So any licensed agency that's going to come into your home, they're going to develop a care plan.
Okay.
They're going to do an assessment with
okay.
your loved one.
And do they
determine-
charge for that assessment?
Some companies do.
Okay.
Some companies don't. So
Okay.
it all depends upon who you're working with. And so get
I see.
clarification.
Yeah.
Are
Right.
you coming in and do you offer a free consultation or assessment and those types of things?
That's a good point.
Yeah. And then set the expectation of what you're hoping to accomplish with your loved one, and then also so that way the company can determine what tasks are going to be we're sending them in. And normally, again, if you have a reputable agency that you're working with, they're going to send you a care plan that they look to follow.
Right.
They'll probably be doing follow-ups on that if it's long-term. That they'll look at it and make sure that the tasks that we set originally are being done and done efficiently. And then if there's additional things that need to be done.
Okay.
Sometimes you have agencies that come in and they just give you a flat fee and they say, we'll do this, but then when they get in there, they start adding all these ancillary services.
I see.
Could be additional costs.
Right.
And those types of things.
So you want to make sure you know what you're paying for.
Along with that, sometimes there's shift differentials that some agencies charge. So they may quote you a low price.
Okay.
But then when you get down to what hours you need them to work and you get your invoice, it may be different because of the different hours that you selected for them to cover.
So a good question then would be to say, is this, the cost regardless of what time of day or night or weekend or weekday, right?
Exactly.
Okay.
Exactly.
Okay.
Yep.
Uh-huh.
I think another thing that would be good is kind of what kind of background or referral are you looking for in regards to who you're sending to my home, right? We want to make sure that we're...
When you say background, you mean like checking their background?
Correct.
So is that something like a licensed company's required to do?
Most licensed agencies are required, again, which is good when you get a licensed agency.
Yeah.
Or if you don't do a licensed agency, again, make sure that you get somebody that's certified.
Yes.
So that because certifications usually mean that they do have to have some kind of
class work and some type of
background.
certificate.
Yes.
Okay.
So, but yeah, we do, you want to always make sure that they have what kind of backgrounds that they're doing on there, and then what kind of training is provided.
Right.
So that we know that who's coming in to provide care knows how to handle the respective client. Because, you're going to have different levels of care that's needed. So you don't want to get somebody in there that's not comparable to being able to provide that.
Yeah. Now, do you have different levels of caregiver, or does the industry have that, or is it,
Each agency is a little bit different in how they define the level of care.
Okay.
For example, one company has a companionship level all the way up to a skilled level.
Okay.
So they send in a caregiver that matches what the needs are for the client, which should document it through the care plan.
Okay.
One other thing I wanted to point out about the care plan is that if your loved one came home from the hospital or is receiving home health, physical therapy, or occupational therapy, and they have exercises they need to be doing on their own, our caregiver, and in some cases, some of the agencies, if they know it, they'll help work with the client to practice those exercises on their own outside of the time that the home health person is there.
Right, right. So when the family might, obviously because you're there, do you find that there's more of a cooperation by an outside person being there for that, or do they blow you off
because
you're like?
Depends on the person.
Oh, okay.
Mother, she when the facility that I take her to the day, she kind of has a tendency to isolate, and so when I'm involved, I try to incorporate her.
Okay.
And so You know,
Right.
It varies.
Okay.
And that's, again, you want to find someone that's a good personality
Yeah.
with your loved one,
Right.
so that they can really acclimate. And a lot of agencies will work with you in that regards.
Yeah. If you're able to describe some
With-
quirks
Things
or
you like,
things.
yes,
Yeah.
absolutely.
Yeah.
Now, some agencies just send them one body,
Yeah.
and that's the best they do. But other agencies will actually work with trying to do a personality match and make it be a working relationship for
Right.
both the caregiver and the client. So another part that I think is important is to consider that oftentimes the agency can be the bad guy. Maybe there's
Yeah.
a safety hazard. For example, I had a client who had beautiful rugs throughout her home, but they were a safety hazard because her feet kept hanging on them, her roller board kept rolling. What do you call it?
Rollator. Yeah.
Yeah, rollator kept hanging on the rug,
Okay.
making her fall risk. And so the daughter had tried her best to get her to move the rug, and she refused. So I came in and did the assessment and said, okay, we have to move these rugs. You're going to fall. We're going to come in and find you on the floor.
Right.
And that's not what we want. So we did a compromise. She got rid of half of the rug, and then the other two rugs, we rolled them back.
Yeah, okay.
So that you could still see the
Yeah.
pretty part, but they
Yeah.
weren't in the way for her roller aid.
Yeah. So what I'm hearing is that one benefit is that you can be the voice of, I want to say experience or authority on the subject, and not relieve the family of having a tug of war or be the bad guy sometimes.
Exactly.
By coming in and making the very same suggestion that the family made.
Exactly.
So what type of things do you do regarding in the home besides the, I'm envisioning, bathing and toiletrying and things like that, but are there other things, more soft skills that?
Well, some of the things we try to do is engage the client into talking. Maybe it's reminiscing about something that was important to them. We had one guy who loved to play his guitar, and so we would engage him in playing for us, and we would encourage him in that. Another person loved crossword puzzles, and so our caregiver would come in with a crossword puzzle book.
Okay.
And some others have enjoyed playing certain card games, and so the caregiver might come in with a deck of cards that fit the client's desires. Or we can, some still like to socialize, but they have trouble getting out because they can't get there.
Right.
And so our caregivers can take them wherever they would like to go within the scope of what the family has said we can do.
Okay.
So your main thing with that, I'll just piggyback off of what Genell said. I think you want to just look for what your loved one used to like to do.
Okay.
And then find somebody that can,
Draw that out, or
Exactly.
yeah.
just have that kind of engagement.
Yeah, and it can look different, but as
Sure.
long as it's,
Absolutely.
in that wheelhouse of
Yep.
things that they enjoy doing, whether it's gardening or playing an instrument or something.
Yeah, whatever they like.
So, one issue that when I was involved in home care, some of the younger folks eat out a lot and are not as adept at cooking meals. Boiling chicken or some crazy thing like that. Who wants to eat boiled chicken? No one. How do you, that just led me to think, like, how do you train your people on things that they don't bring to the table? Do you ask them in the interview? Do you train them outside of that? I mean, what kinds of things do you,
I mean, you're right. I mean, not a lot of individuals have the skills that our grandparents may have had in the past.
Yes.
My grandmother, she would actually take the live chicken and it ended up on the dinner
there you
table.
go.
So,
Yeah, without going into all the
Right.
detail, because I've seen what they do. We don't
Yes.
want, This is not Dr. Pole where we're going to do any kind of animal husbandry here.
But
Yeah.
it is, it's and it's to find somebody with that skill set.
Right,
is,
if that's important to them, yeah.
sure.
Yeah.
Then you want to find an agency that
Yes.
will help define that, whatever the family's needs are. If
Right.
you want healthy eating, then
Right.
work with the agency
Yes.
to find somebody that can potentially assist with that.
Yeah. So I think, I mean, you said it really succinctly, but I'm going to say it the Mary Lou way, is, really ask for what you want.
Yes.
And I would say, in order to get what you want, maybe you have to not over ask, but go into more detail.
Yeah.
And, allow them to say yes or no, we can or can't do that.
Mary Lou, this is kind of like what I feel and appreciate this service that you provide. It's just understand, like, this is for your loved one.
Yes.
Right? It's almost like receiving medical care for yourself.
Yeah.
You don't have to take what the doctor says and
Right.
just go with it.
Yeah. My mother's refused a lot of things.
Yeah. I mean, just well, and then
Mom, don't listen to this video.
I understand.
my mom's a little bit more compliant, so I'm thankful
Yeah.
for that. But it is. It's I recently went to the doctor.
Yes.
And I know that I'm a little overweight.
Yeah.
And so. And I was saying this, he immediately gave me something to do. It's like, no, do I need to do that right away? And so just ask.
Yes.
You said it very well. Ask for what you want.
Right.
And then work with.
Ask her for your ideal situation.
Yes. And
Yeah.
then work with them. And
Yes.
if you find a reputable agency,
Yeah.
you're going to find somebody that's going to be willing to do that.
Okay. Well, we're believe it or not, like down to like 5 or 7 minutes before we're finished. So I want to give you all a chance to say, we talked in generalities. Let me ask you, how is Home Helpers different? What do you feel like you do different that makes you, stand out or, be the organization that they should call?
Yep. Well, I kind of mentioned it in passing.
Okay.
Both of us have understood caregiving personally.
Okay.
I've been primary caregiver for my mom for the past 8 years. So I get it. I
Right.
understand
Sure.
what it takes.
And your mom lives with you, if I'm
Mom
not
lives in
mistaken.
my
Yeah,
home.
so we're not talking dropping off meals and, taking her to the doctor appointment. You're talking day in and day out
Yeah,
care.
She's been living with me for 8 years now.
Yes.
So, but yeah, so we get it. We understand. So I think that is a differentiator.
I
up
agree.
front.
I agree.
We know the responsibilities the family has.
Yeah.
We know and understand what it takes. We know and understand overwhelming
Yes.
responsibilities.
Yes.
And so, so kind of one of our taglines we have is we're not just home care. We're home care with a heart.
Right.
We get it. We
Yeah.
understand what's going on in the lives of the ones that are responsible, and then even trying to have that for the loved one.
Translate over to them. Yeah, yeah.
And know what
Yeah.
they're,
Yeah.
I see every day. And again,
Right.
it brings me to a humbling experience
Sure.
to know how to respond to mom sometimes
Yeah.
when I hear other family members, because it's a different perspective.
Yes.
Right? You always have that
Yeah.
outsider's perspective.
Yeah.
So we get that.
Right.
And so,
We earlier we were talking with a audiologist, and we were talking about caring for someone is the most wonderful job you can ever have, and it's also the most challenging to have, both physically, emotionally, and all of that. So having you two personally understand that is a big. I do agree with you. It's a big deal.
Some of the other ways that we are different from other home care agencies is that we can be a boutique where we can customize our care plan to be very specific to your needs. One of our clients, we literally take to church every Sunday, and she had a Bible study on Thursday that we take her to, and our caregiver stayed with them. And that's another differentiator. Our caregivers stayed with your loved one. They will take them to the doctor and be your eyes and ears.
Right.
We have caregiver leads who help to make sure that our caregivers are trained and are doing the right things in the home.
I'm going to stop you there because you just glossed, I feel, over something. Caregiver leads. What's a caregiver lead?
That's a great question. They are caregivers who have been caregivers for a long time and who have become an expert in knowing how things need to be done and can
So they like set an
convey-
example.
Right. And they
Right.
can convey that way of doing things to the new caregiver. And they are usually the ones who help do the introduction of a new caregiver with the client so that the client experiences the optimal experience
Right.
with everything that they wanted to do.
Okay.
One other quick thing that we do is we offer a program. It's called Cared For, and it's the cared number 4.
Okay.
Much like you have resource 4. So, but we actually embody the whole aspect of the individual.
Okay.
From nutrition to their personal well-being to
Right.
Monitoring systems that
Right.
we can offer for safety purposes
Okay.
and those such things. So we have that
Right.
proprietary
Sort of
program.
envelops the whole care experience.
Exactly.
What about, often you hear two things. One, we only have about 3 minutes, but we hear, I'm tired of the caregiver being on the phone all the time. And two, my caregiver called out. What's going to happen?
Good question. So that's one opportunity or good thing about working with an agency is because normally the agency is going to have a backup.
Okay.
So we utilize our caregiver leads from that perspective
Okay.
to assist with that.
Right.
There's going to be times where we can't always fill it, but
Right.
that's usually, again, with you're working with an agency, they're going to have that type of backup.
Okay.
So.
And are your caregivers on the phone?
I didn't address that one. So we actually
We only have a minute, so.
we do have a WellSky app that they do a lot of their care plans through the phone.
Okay.
But we train to the
Yes.
standard that, and again, it's
Right.
where we set that
Yes.
expectation that, hey, we're
Right.
here to engage with the family. So,
Yes.
yeah. But great question. Thanks for bringing that.
You're welcome. I heard that a lot. Your caregiver's not going to be sitting here on their phone, are they?
Right.
So how can we, in our last minute together, what's the best way for people to reach out to either one of you or to the company?
Yeah. So our website is midsouthhomehelpers.com, and our phone number, the best way to reach us is 901-414-9696. It's answered 24/7. So
Excellent.
if it's not answered, it's definitely we get back with you within the hour.
Awesome. Thank you so much, guys. I
Absolutely. Thank
enjoyed
you.
this today.
Thank you.
You're
Appreciate you
welcome.
having
You're
us.
welcome.